advising us on pediatric cancer. The phone lines will be opened very, very shortly. To call in, the number to call is 07000 917 917, 07000 917 917. This is Radio Doctor WFM 91.7. It is 12 minutes past 10. My name is Temitope Oluleye. So let us move right along. On pediatric cancer today, Dr. Akinola, what is pediatric cancer and is it contagious?
Thank you, Temitope. Pediatric cancers are cancers that occurs in children. It's cancers that occur between birth and adolescence. That's between the age of from birth to 19 years.
Okay.
Those are the those type of cancers are classified as pediatric cancers.
Okay.
Children can develop all types of cancers, but some are more common in younger people than older people. And the most type of pediatric cancers include leukemias, which are cancers that occurs in the bone marrow.
Okay.
We have the neuroblastomas, then brain and spinal cord cancers. There is what you also call Wilms tumor. There is a rhabdomyosarcoma,
Okay.
osteosarcoma, and Ewing sarcoma. They affect the bones. Then we have the lymphomas, which can be Hodgkin's or non-Hodgkin's. Then we also have what you call retinoblastomas, which is the cancers of the eye. Children also sometimes develop other cancers which are more common in adults, but this is very rare.
Okay. Thank you very much, Dr. Akinola. Now, what are the most common types of childhood cancer?
I've mentioned earlier that leukemias, the brains and spinal cord cancers. We have the Wilms tumor,
Okay.
then neuroblastoma, retinoblastoma. They are the common types.
So those are the most common types that children can have. Now, how common is it among children? How common is childhood cancer? Is it very, very common compared to other diseases?
In general, childhood cancer is rare. In United States, the statistics say that 1 in 25 children will be diagnosed with cancer before they reach the age of 20 years. WHO estimates that up to 30,000 children are diagnosed with cancer every year. 80% of these live in low and middle income countries, such as Nigeria.
Okay.
So, in general, it's rare when you talk about, when compared to other common form of illnesses.
Okay. All right. Thank you very much, Dr. Akinola, for your response. Now, what are the symptoms of pediatric cancer?
Symptoms of pediatric cancer depends on the type of cancer. There are different types of cancer, and each one will also have different kinds of signs and symptoms, depending on the location and also the type of cancer that we have. Sometimes they may have a non-specific symptoms that is similar to the common childhood illness.
Okay.
But some of these symptoms, signs and symptoms, if you notice that, then it's something that you need to be concerned about as a mother. When you have continue and unexplained weight loss, when you notice your child is continually losing weight, unexplained, despite maybe the child is feeding, yet child is losing weight, you need to be concerned. When you have a headache, constant headache with early morning vomiting,
Yes.
that can, point to probably there is something happening in the brain. Maybe some of the cancer of the brain can present like that. Then when you have increased swelling or persistent pain in the bones, in the joints, in the back or leg, and pain is constant, is persistent, despite use of medication, you still have the pain, then you need to be concerned as a mother. Then when you notice unusual lump or mass or swelling in the abdomen, the neck, the chest, the pelvic area, or the armpit, then you have to be concerned. Then when you notice unexplained bruising or bleeding or rash, in your child without trauma, you notice that the child have just developed easily bruised, and constant bleeding or rash that is not, you can't explain the cause, then you need to visit your doctor.
Yes.
Then you notice constant or frequent persistent infection. You notice that this child gets sick, easily, frequently. You may need to go and see your doctor to review what is happening. When you notice a whitish color behind the pupil of the eye, it is maybe pointing you to cancer of the eye, retinoblastoma. When you notice nausea that persists or vomiting, that persists without any cause, then maybe need to review the child. You notice constant tiredness or paleness that is unexplained in a child, or you notice sudden eye or vision change that occur and persist. Then, or you notice recurrent fever of unknown origin, or you notice a child that is limping, without unexplained limping without any cause, no trauma, then you need to be concerned.
Thank you very much.
To review that child.
Thank you, Dr. Akinola, for explaining those symptoms for us in detail. The 10-minute sponsorship segment that we're going to start now, it is 20 minutes past 10 at the moment. And this segment of the program is being sponsored by Ariku Golden Lions Club. And moving right along with questions about pediatric cancer. What are the causes of pediatric cancer?
5% of childhood cancers, they are caused by inherited mutation, that is genetic mutation that are passed from the parent to their children. This mutation in genes, it leads to uncontrolled cell growth, and which eventually leads to cancer. In summary, 5% of childhood cancers are caused by genetics due to the mutation in the genes. You can't explain, but It's just due to genetics. They are caused by that. Other risk factors for developing childhood cancer include having sibling with cancer, especially leukemia. If you have one of your sibling having leukemia before, the risk factor is higher, that other sibling may also develop
Yes.
leukemia. There are some genetic syndromes that are linked, they have high tendency of having cancer, especially Down syndrome. They have a risk factor, high tendency of developing leukemias. Other risk factors include environmental risk factor, such as exposure to radiation, exposure to tobacco smoke,
Okay.
especially secondary school smoke. When your parents are smoking,
Yes.
you know,
Mm.
you are exposing your child
Children,
to a
yes.
secondary smoke. And tobacco smoke can also is a risk factor for development of cancer. Environmental pollutions, a lot of things are being released into the environment,
Yes.
Either to do increase industrialization
Yes.
due to traffic, exhaust from the traffic. So a lot of these factors combine together and increase the risk factors
Okay.
to development of childhood cancer. Exposure to chemotherapy, some other chemicals too are also known to have risk factor of developing, if we are exposed to them, to develop cancer, benzene. Then immune system suppression, either may also be genetic or due to one thing or another, use of also chemotherapy, reduce immune system. All these things, combine together to increase the risk factors for developing childhood cancer.
Thank you. You have questions on this topic on pediatric cancer that you love Dr. Akinola to answer. Please call in on 07000 917 917, 07000 917 917. You can send a text or WhatsApp message to 070 The topic we're discussing on is pediatric cancer, and this is Ready Doctor on WFM 91.7. Moving right along, do genetics have a part to play? Can genetics cause pediatric cancer?
Yes, I've mentioned this earlier,
Okay.
that 5% of childhood cancers, they are caused by inherited mutation, genetic mutations, that are inherited from one or two of their parents. This there's mutation in the genes, and some of these are transferred, to the child, and leads to uncontrolled cell growth in the child,
Yes.
which eventually develops to cancer.
Okay.
So genetics have a role to play in the development of childhood cancer.
Now, are there any treatment options? What are the treatment options available
Yes,
for children that have
there are
cancer?
several treatment options that are available in the management of childhood cancer. This depends on the type of cancer,
Okay.
and this includes surgery. Some of these solid tumors,
Yes.
they may need to be debulked. You call it debulking, reduce the mass
Okay.
by surgery Then there may also be different combination of treatments. You may need to combine surgery with chemotherapy and radiation. So we have different treatment options, which include surgery, chemotherapy, radiation, and immunotherapy. And there are some that you may need to combine one or two treatments, for the treatment of the cancer.
Thank you very much. If you want to call in to ask questions, please feel free to do so. Go ahead and call on 07000 917 917. 07000 917 917. You can send a text or WhatsApp message to 070 317 Our special guest on the program today is Dr. Olufunmilola Akinola, a pediatrician at St. Ives Family Hospital. What are the possible side effects of the treatment for pediatric cancer, both short-term and long-term?
The treatment of childhood cancer also comes with its own complication.
Yes.
The complication can be classified into the short term and the long term, just as you have mentioned. And the short term complication includes vomiting, nausea and vomiting. Some of them may have mucositis. That there is it affects the mucous membrane, and they have mouth problem. Some may even present with diarrhea. Weight loss is one of the short time to long term complication. Tiredness, easy fatigability.
Yes.
Most of them come with pain, hair loss, just as you have in adults. We have bleeding due to anemia. By the time they are exposed to chemotherapy, to radiation, it causes anemia. There is increased risk of infection. Also, these are some of the short term, complications.
Yes.
Then for the long term effects, they may develop neuropathy, such as hearing problem. There may be cognitive difficulty. They may also affect their growth and development, may affect sexual development. They may comes with neurocognitive impairment, musculoskeletal morbidity.
Okay.
They can also come down with endocrine dysfunction, which may lead to early or delay puberty, menstrual irregularity. These are the cardiotoxicities. These are the long-term complication or effect of treatment.
Thank you, Dr. Akinola. This 10-minute segment of the program was sponsored by Ariku Golden Lions Club. It is 10:30. Yes, this is Radio Doctor on WFM 91.7. Radio Doctor is a free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult free and advise on radio on your Women Radio. I have our radio doctor today, which is Dr. Olufunmilola Akinola, with us. Have questions? Please call in on 07000 917 917. 07000 917 917, or send a text or WhatsApp message to 070 317 565 37. Moving right along, Dr. Akinola, If parents have a question about the child's normal growth and development when it comes to cancer, can cancer affect a child's normal growth and development?
Yes, I mentioned earlier, yes, it can affect normal growth and development of a child.
Yes.
Um, when you expose a child to radiation, maybe do treatment during during cancer treatment,
Yes.
can result in damage of endocrine organs such as the pituitary hormones,
Okay.
pituitary organ, and it can affect the child growth. It slows the growth, it affects bones development, which eventually affects the height. The child may not be able to attain his full status, the full
Yes.
height. It also affects the sexual development. You know, the hormones that are responsible for sexual development,
Yes.
puberty affected, may cause early puberty, may also result in delayed puberty, menstrual changes, menstrual abnormalities, you know, all these things, are results probably comes from the effect of radiation or chemotherapy that the child is having. So yes, it affects the normal growth and development of a child. It can.
Now, if a child has cancer, what are the chances that the cancer will come back after treatment?
Um, from statistics, overall, about 4.4% reoccurs by 10 years of age. The possibility of past cancer reoccurring in a child is high, though it may not even be the same type of cancer, maybe another types, and it may be due to probably the effects of the treatment or whatever the child is exposed to
Yes.
during the treatment of
Okay.
the initial cancer. So overall, 4.4% reoccurs by 10 years of age, 6.2% by 20 years of diagnosis. Sorry, of diagnosis,
Yes.
not age.
Okay.
Then for bone cancer, it reoccur in about 13% of survival.
Okay. All right. And the survival rate of children with cancer? The survival rate.
The survival rate is has improved
Yes.
due to advance in research. Survival rate in most developed country can be as high as 80%, but in low-income countries, that's maybe about 20 to 30%
That's very low
survival rate.
compared to other countries.
Yes, there's a lot of factors. Most of them present late, and also the treatment, the cost of treatment, the available of drugs, of chemotherapy drugs,
Yes.
and also center for radiation. A lot of factors are responsible for that. But due to increase in advance in research,
Okay.
the survival rate is better than what it used to be.
Yes.
But in low-income countries like ours, there's still a lot of factors that are responsible for this low survival rate.
Yes. Thank you. We're still expecting you to call in to ask questions. Even if you don't have a question on this particular topic, pediatric cancer that we're talking about this morning, if you have questions concerning your children's health, go ahead and call in on 07000 917 917 07000 917 917. Once again, 07000 917 917, or send a text and or WhatsApp message to 070 565 37. When it comes to children being able to live a normal life after treatment, when kids have cancer, can they live a normal life after treatment?
Yes. Most childhood cancer survivors can go on to have healthy, live a normal life after surviving. They can go on to have healthy children. Though some of them may have some risk, some of them may have some complication. Some male children may go on to develop decrease in fertility. Maybe low sperm count or other.
We have a call coming in. Can we just quickly pick up the call? Hello, good morning.
Good morning.
Yes, what's your name, please? Where are you calling from?
My name is Lion Marigold.
Okay, thanks for calling in.
Golden Lions Club.
Okay, thanks for calling in. What's your question? Okay.
I want to know the cause of this childhood cancer.
Okay, the cause of childhood cancer.
Yes.
Okay. I think the doctor already mentioned that, but she can repeat it again. Thank you for your call. Thank you.
Thank you for your call, ma'am. I mentioned earlier that there are a lot of factors that come to play when it comes to the development of childhood cancer. 5% of it is due to genetics, due to mutation in the gene, that are passed from the parent to child, and this cause abnormal growth of cells, which results in cancer. I also mentioned that there are some genetic syndromes. They are prone to, have increased risk of developing cancer. One of it is Down syndrome. They have increased risk factors of developing cancer out of the general population. There are also some environmental factors that also come into play. Environmental pollution, a lot of pollutants they are released into air from traffic, due to increase in the industrialization, lots of gases, that are released into air that have harmful effects, causing cancer. One of these also tobacco exposure to tobacco smoke, either from the parent or secondary exposure. All these factors come to play. Also exposure to radiation. Radiation, either medical radiation or industrial radiation, ultraviolet light, X-rays,
Yes.
All these
we have
factors.
Another. Can we just pick up this call, Dr. Akinola? Hello?
Hello, good morning.
Yes, good morning. What is your name, please? Where are you calling from?
Yeah. My name is Lyle Ogechi from Arab Golden Lions Club.
Thanks for calling in. Please go ahead.
Please, I want to ask, at what point will parents begin to separate like malaria symptoms or typhoid symptoms to begin to suspect any other thing like this pediatric cancer, and where can they go to ensure that the right diagnosis is gotten?
Okay.
Is it the normal hospital? Is there any special hospital that such parents can take?